watch them bloom for me and you.
Welcome to another edition of Tree of Life's Holistic Wellness Center's Healing Through Nature. Today we're going to talk about parasites. And I know for most people this is not a very pleasant subject, and probably as we proceed through this lecture and I throw up some slides, you're probably not going to feel any better. But this is a very important subject, something that we find just about every day at the clinic, and I feel that it is such an important topic. More people have this than are probably aware of it, and so many diseases are misdiagnosed when they're actually from parasites. So that's what we're going to talk about today. All right, what are they? All right, the word parasite is a very broad term. It can mean what most people would be familiar with is our intestinal worms. That comes in a wide variety of different kinds. There's a number of them. Some of the most common: roundworms, pinworms, flatworms, hookworms, tapeworms. Two of the most common I see at the center are pinworms and hookworms. We see pinworms a lot with little babies and little children. You won't even be aware that they have them, except that they get very uncomfortable, gassy, bloated, rashes around the bottom areas. Pinworms have a tendency to only come out at night, and they're little tiny white dots, little worms, and you won't see them unless you check your child at night if you're suspicious, because that's the only time they come out. All right, some of the most common ones though are hookworms. We see quite a number of those. Easy test is a stool test at most clinics. I think we'll probably be able to do it. We've seen quite a few ourselves. All right, how many people have parasites? More than you would think. Most people think parasites are a third world disorder or disease. You have to go to Mexico or you have to go to Africa to get them, and that is not the case by far. According to the CDC, approximately 1 out of 6 Americans have parasites. I tend to think that that's a rather conservative number. I think more people have parasites than that. But again, according to the CDC, about 1 out of 6. I find that most of the times we get a stool test done on patients, most of the time they do have parasites. Again, I usually order them because I suspect it, so maybe that raises the odds a little bit, but I think more people have them than are aware. All right, how do you get them? Okay, getting parasites is actually incredibly simple. You can get it from a tainted water source, which is not all that uncommon. You can get them from unwashed fruits and vegetables. If they're not being taken care of well, they're handled too much in the grocery store, you really don't know. So unwashed fruits and vegetables, uncooked or poorly cooked meat will actually cause it as well. Very, very common from pork and other meat sources such as that. Let's see, one of the most common ways are other animals. When you have dogs and cats living in your house, and if they have a tendency to be able to go in and out of the house, they're not strictly out inside dogs or cats, then there is a good chance that sooner or later either them or you or both are going to end up with intestinal parasites. Again, they come out at night, and a lot of people let their dogs and cats sleep with them in the bed. Pretty much guaranteed you're going to get parasites sooner or later if they happen to be able to go outdoors on a regular basis. I had a little young patient some years ago. She was 9 years old, and one morning she was complaining to her parents that she was itching a lot down there. Okay, so the parents checked, and they found a little worm. So they brought her in, and we arranged to have a stool test done, and sure enough, she had little hookworms down there and such, and pinworms. Fortunately, we were able to treat her, and they were gone within just a couple of weeks. Where did she get them from? Well, about a few weeks prior to that, they had gotten a little stray kitten, and of course, she liked the little kitten sleeping with her. Well, stray kitten came in with worms, gave her the worms at night. That is one of the reasons why very often when one member of the family has worms or is diagnosed with them, usually you treat the whole family and you wash all the bedding, all the clothing, you clean everything up, because if not the worms, then the eggs and such. And so you treat one, pretty much advisable you treat the whole family, because most likely you won't get it if you don't get rid of it. All right. Other ways: infected clothing, infecting beds. Children have a tendency to get them very easy because they have a tendency to love to touch things and then touch their mouths, and they love to pick food up off the ground and pick up objects and taste them, and because they're curious and they're trying. So that's a very common place for them to come through as well. So you got to kind of be careful with that. Okay. So they're easy to get. They're very, very common. I know that they creep a lot of people out, but again, being as common as they are, and they are very, very easy to get rid of, especially if you're proactive and try to make sure that you get rid of them early in. So how do you know? How do you know if you have them? Okay, well, some of the most common symptoms that come with parasites. All right. It's strange, but two of the most common symptoms that we see are anal itching, because especially in the morning or at night, people will notice that they're itching down there. And that is a very, very common symptom. Yes, there are other reasons for anal itching. There can be hemorrhoids are a very common reason for it, but most people know if they have hemorrhoids or not and if they're acting up. Especially children, you're going to see a lot less of that. So anal itching is a common and a very, very common symptom that a lot of people are not aware of is grinding your teeth at night, spraxism, chewing or grinding your teeth at night or clenching your jaws at night. Very often you're not aware that you're doing that. Usually it takes someone else who, like a partner or a brother or sister, children sleeping close together, or parents aware of their children at night, or the husband or wife or partners noticing the other one is grinding their teeth at night. And unless someone tells you that, or you wake up in the morning and your jaws are hurting quite a bit, and you know that it's not due to anxiety, okay, which is a common reason for grinding your teeth also, that can be a good symptom for parasites. Other very common ones, and these are very common, and so they cross the spectrum of a multitude of different diseases that they could account for, but constipation. Constipation is incredibly common in this country, so not everyone that is constipated is going to have parasites. But unfortunately, constipation is a very common symptom. And then on the other end of that is diarrhea. Okay, most people think of diarrhea as the opposite of constipation. But what most people don't realize, just as a side note here, is that a very large number of diarrhea is actually a form of constipation. And they'll come back and they'll go, how can they be constipated? When everything is coming out. Actually, it's not. Most of the cases for diarrhea is actually a form of constipation. What that means is that the bowels are impacted, the fecal matter is not moving out. And so what happens is that one of the defenses the body has is to flood the colon with water. All right, so it floods the colon hoping to break that material up so that it will go out. Okay, and so what you're actually seeing is a whole lot of that water coming out with not a whole lot of anything else. And so it can be. But there are occasions to where diarrhea can be due to a lot of other things. It can be due to parasites. It can be due to viral or bacterial infections, cancer, just a whole lot of things. But again, diarrhea and constipation are a common form. And what we often see is in conjunction with parasites, in conjunction with constipation and diarrhea, is the gas and bloating. I had a patient some years back. He came in, he'd had very, very serious upset stomach, a lot of gas and bloating, a lot of diarrhea. And it was extremely unusual for him. This had begun going on for 3 months. He came into the clinic, so we sat down and talked for a few minutes, and I said, okay, what happened about 3 months ago? And he was like, well, I don't really remember very much. And I said, were you out of the country by chance? And he says, yeah, about 3 months ago, I'd gone to Mexico. But I never left the resort, so that couldn't have been it. And I said, no. I said, did you eat the fruits and vegetables there that were at the resort? And he said, yes. And I said, well, there you go. I said, the water was full, most likely of parasites. They washed the fruits and vegetables every day, and you ate them, and voila. Well, a stool sample was tested, and he was rife with parasites. It was incredibly massive. I don't know how he'd gone 3 months of dealing with this. We put him on a basic program. We'll talk about that here in a little bit. And it took about 3 weeks. And in 3 weeks, all the gas and bloatiness had gone away. The diarrhea was gone. We had him retested. No more parasites. So it's very common. Other issues, pains and aches in the back, joints or muscles. Irritable bowel syndrome is very often parasites. It's a shame more testing of this is not done. It's either the tests are not requested by the other doctors, or when they're done, they're poorly done. It takes, when you get a sample, you have to test that same, you very often have to test that same sample over and over again in many parts of the sample, because you could actually take some of this fecal matter, test it, and you just happen to miss some of the parasites. And so most places, unfortunately, are not very thorough in their testing, if they even do the testing at all. You hear irritable bowel syndrome, IBS, and the first thing they go with is inflammation. Fine, inflammation. What caused the inflammation? It can be dysbiosis, which is an imbalance of the microflora, the bacteria and yeast in your intestinal tract, but it can also be parasites. And I have seen more times than I would count here right now of the amount of times that I have seen IBS was actually caused by parasites. These people have lived with this problem for years and years, only to find out about 3 weeks worth of treatment, and it went away. So I've seen that terribly common as well. Allergies. Allergies are very common, because one of the things that happens with parasites is that the body has an immune reaction to this foreign body inside of it. And sometimes that immune reaction kind of goes into overgear, goes into hypergear, and doesn't gear back. And so people end up with all these allergies, and of course then the parasites cause inflammation of the intestinal tract, which then causes leaky gut, and so foreign proteins and particles leak into the blood, and you end up with allergies. And all be all, in those cases, it was the parasites that were the original root factor, and if they had just been taken care of, and then treat the rest of the bowels, very often we see the allergies go away as well. It takes time, but it can. Treat the root cause first. That is the main key. Other things like itchy ears and nose. We talked about the anus, nervousness. Chronic fatigue is incredibly common with parasites, because you're malnourished, and so you're not getting enough food to eat and enough nutrients. You're basically feeding the beast within, like the old show, Rocky Horror Picture Show, Feed Me Seymour. Well, that's what's happening. They're just crying for food, and you're feeding them and not feeding yourself so well, which then drops your immune system, which makes you even more susceptible to parasites, and it's a vicious circle, and it just keeps getting worse and worse. And unfortunately, I have seen people live with parasites for decades until we were able to talk to them and find out what it was, and they've been misdiagnosed for all those years unnecessarily. Okay, anemia, very, very common symptom. Again, you can have intestinal bleeding, you can have malnutrition, so that the body just doesn't produce enough. It can't absorb the iron because the intestinal wall is inflamed. The list goes on and on and on. You can become excessive weight. You can also have a great weight loss, either way, depending on the types of parasites and how long you've had them as well. Vision problems, we've seen those type of things. We've seen even blindness occur because of parasites. Had an elderly lady in the clinic years ago, and her other doctors had said she was crazy because she kept saying that there was something in her eyes, and she was an older lady, she was about 80 years old, and her other doctors were saying, well, we can't find anything. And she came into the clinic, and she put on my desk a medication that was prescribed for her. And I looked at the medication, and I looked at her, and I said, were you told what this medication was for? And she said, no. She said, my other doctor just said, here, you'll feel better taking this. And it was an antipsychotic drug. He basically had just assumed that she was crazy. Fortunately, between myself and an ophthalmologist, another eye doctor, we found out that absolutely she did have parasites in her eyes, and we treated her for the parasites, and for as far as I know, everything else went fine after that. So again, one of the things that doctors need to do is we have to be aware that, yes, patients can misdiagnose themselves or overdiagnose or be hypochondriac, but we also have to know to trust them in their own skin, to at least give them the benefit of the doubt, and at least do the due diligence and do a bit of discovery and look and find out what's going on. And unfortunately, so many don't do that. Okay, all right, problem sleeping is also very common, but another very common symptom as well is anxiety and depression. I sometimes wonder how much anxiety and depression is due to intestinal parasites. I know a lot of psychiatrists would not probably like that, And sometimes it's that simple. And of course, probably most of the time it's not. But there are times when it is. And it's a shame that they end up being put on drugs and not being given a full medical, because when you take psychology in med school, one of the things you learn is before anyone is diagnosed with any disorder, you first meant a psychological or psychiatric disorder, you have to rule out first all medical explanations. And unfortunately, they don't do that. And sometimes it could be as simple as parasites or candida, something of that nature. But we're a very, very, very bad diet. All right, so those are some of the symptoms. Those are some of the ways that you can get them. All right, what do you do if you have them? All right, well, conventional medicine, it's antifungals, antiparasites, formulas. They do work, some of them. Some of them don't work very well at all. Some of them are not well handled, well tolerated. A very large number of them are extremely hard on the stomach, and they're also they can be very, very hard on the liver. So one of the main places that parasites like to live, intestinal parasites other than the intestinal tract and the stomach, is the liver. So if you're taking a drug that's already hard and not well tolerated on the liver, you're just damaging the liver and making it more open to more infestation and infection. So it's very common, but most thing to do is just give you an antiparasite, antifungal drug, and after that, most of the time they don't even retest you to find out if it was gone. And maybe, if you well tolerate the drug, maybe you might feel better there. And maybe it does take care of it. But very often it's either causing more damage or it didn't get the eggs because it wasn't a long enough trial. And sooner or later they come back. One of the most important things to do when you're treating parasites is to make sure that you do it in cycles. And that's one of the things that, for example, we recommend, is do it in cycles. You first hit the living parasites, the living intestinal worms. Then you actually take a break for a few days. Then you hit it again, very same thing, because you're trying to get the ones that just newly hatched. And then you do that for a few days, then you take a break, then you hit it again. You're trying to get all the new young ones, the mature ones, and all the eggs. And we find out that when patients do this, in every single case that we've done, as long as they follow it correctly, they're gone. And they're amazed at how quickly usually they start feeling results within about a week or so. Most intestinal programs, at least that are from a natural point of view, usually last probably about 3 weeks. In really severe cases, it may take a month or more, a month and a half even. But normal cases usually about 3 weeks, and that's usually what does it. Now, what are some of the common things that you can do to work with? Oh yeah, but one thing I wanted to talk about is, before we talk about the final treatments, what are some of the different kinds of diseases that can come about? You know, I talked about irritable bowel syndrome, talk about even blindness and anemia, malnutrition. There are some others. There's malaria, which is rare, but it can happen in the United States, Lyme disease, and so forth. So I guess what I'm trying to point out is always make sure that you get second opinions, that you don't just immediately trust that, one, it's an incurable disease, and two, that the other doctor did not dig down deep enough. I've had a lot of MDs. I've had 2 particular cases of MDs come to me quite upset, not at me, but upset with their schools. One of the things in naturopathic medical schools that you find is that we have to take pretty much all the same courses that an MD has to take. We have to take the pharmacology and pathology and anatomy. It goes on and on. Right? But then we have to go on and study naturopathic medicine, and that's one of the key points in naturopathic medicine, is to get to the root cause. Don't just band-aid a patient. Don't just treat them symptomatically or allopathically. Get to the root cause. And I've had a couple of MDs come to me complaining, saying that they were upset with their old medical schools because they didn't teach them how to cure chronic disease. They teach them how to write a prescription. MDs there are good ones and bad ones, just like there's good and bad for naturopathic doctors. A lot of the conventional Western medicine is wonderful for emergency medicine, absolutely superb. Your car goes down a cliff, Wonderful. But for chronic medicine, most of them, and they've actually told me this, are not trained in how to cure, only how to treat the symptoms. All right. And one of the most common root causes in this country, other than what we talked about a couple of weeks ago with Candida, are intestinal parasites. And if we would just take the time with the patients, don't take just 5 minutes, but take the time with the patients, do a good intake form, get a detailed intake, go over their history, take the time to do it, and then run some tests. Don't just assume that the patient doesn't know what they're talking about. They're the ones that live in their body. They're the ones that roll around in it. They're the ones that are going to be more sensitive. Give them a benefit of the doubt and let's get some tests done. And we end up being very surprised sometimes. And sometimes it's a very simple issue and we treat and it's over with. Over with in a few weeks. Not always, but a good number of times. All right. What do we do in naturopathic medicine to treat parasites? Well, this actually gets to be a lot less difficult than you think. Again, naturopathic medicine gets rid of the cause, but there's also another definition behind naturopathic medicine, and that is holistic. Holistic doesn't mean just natural and safe. It also means whole body. If parasites are infesting us, then there has to be a reason why we were susceptible to it. We have this amazing immune system in us. This immune system, given the opportunity, given the tools that it needs, and such as nutrients, it will fight off these things. I'd say just about every day, just about every human on earth is exposed to viral infections, bacterial infections, parasitic infections. It's very, very common, very common. But if you have an immune system that is capable of fighting back, that's able to support itself, then what happens is that the infestation or infection begins to try to take hold, our immune system takes it out. Too many people are told that, for example, cancer is a random event. Okay, I had a woman come in again. I think I mentioned this before, years ago. She came in, she said, I have cancer, but other than that, I'm healthy. Okay, I looked at her and I said, no, you're not. And she said, yes, I am. My other doctor told me that I can be healthy and still get cancer. Okay, that does not happen. Cancer is a systemic failure of the immune system. Again, just about every day, almost everyone is exposed to cancer. You get this little errant cell, and it kind of went off on its own in the immune system. If it's in good shape, knocks it out. But in people with cancer, their immune system is already suppressed. It's already impaired. And so there is a systemic issue with that person's body. All right, so it's the same with parasites. It's kind of like when you're out in the garden. It is a very common thing that healthy plants generally can survive a parasite like aphids or other kinds of tomato worms or caterpillars. You'll notice that in a garden that the plants that aren't very healthy are the ones that succumb. And the healthy ones, very, very often, and people who are very well versed in organic gardening learn this, that if a plant is extremely healthy, parasites generally do not go after that plant. They go after the weak. Just like wolves and lions and cougars, they go after the weak that is in the herd. It's the same with bugs. They go after the weak. And if you have a strong immune system, the probability of you getting an infection or infestation is extremely low. So the first thing you want to do is have a healthy immune system. Eat right. Eat healthy. Eat lots of fresh fruits and vegetables, washed, but lots and lots of fresh fruits and vegetables. Try to eat more of a live diet. Patients at our clinic know that I am a vegan, I'm a raw vegan doctor, and we push the vegan lifestyle, a healthy, balanced vegan lifestyle. And we encourage our patients to do that. In fact, many of them we will not even treat because of the seriousness of their illnesses unless they choose to change their diet and lifestyle. But I have seen, after almost 20 years of practice, nutrition is everything. Yes, there's great and wonderful holistic medications, and we have some here we're going to talk about in a moment. But they have to have something to work with, and that is the nutrients that you get from a good diet. In a future episode, I will be talking more about nutrition and things that you can do at home in order to better support your immune system, and we'll talk about that in the future. Along with again, all these things that you can do at home, to take care of yourself. The old cliche, be your own doctor. All right, so nutrition is the number one thing. Be proactive, be preemptive. Take care of your body so that you don't have to deal with it. One time, my wife and I were standing in Whole Foods down in Southern California, and an old joke about Whole Foods is whole paycheck, because healthy food, unfortunately, unrightfully so, costs more than unhealthy food. All right, so we were walking out there, and we were standing in line, and there was a chap in front of us, and we were saying, yeah, we were all joking now, whole paycheck. And he made a good comment. He said, you either pay for it now with good food, or you pay for it later with illness, disease, a poor quality of life, drugs, high health care costs. I'd rather pay for it now, pay for it with good food. And I feel a whole lot better because of it. All right, so that's the first thing, is nutrition. Take care of yourself. Try to cope with stress, because stress is a major factor with illness. If the body is stressed out, your immune system will actually be suppressed. There have been major national studies, one even by Harvard, that showed the more dark you were, the more stressed out, anxious, depressed, angry, sad, that suppressed the immune system. While those that expressed more joy had a much stronger immune system. It's been a well-known fact for thousands of years. Happy patients tend to heal faster than sad patients do. All right, so cope better. Try to put yourself into a less stressful situation, or learn to cope with the issues that you currently are having to deal with. All right, natural medicine. What can you do for the parasites? One of the most common things you can do is black walnut. Black walnut, again, I'm not prescribing this for anyone because I don't know you. I'm just saying historically, what are some of the things that have been used wonderfully for parasites? Okay, black walnut is and this is the hulls of it, the hulls of the black walnut. They are a massive anti-parasitic, antifungal. They wipe them out in droves. We, at the clinic, for example, we use a combination of black walnut and pau d'arco. Wonderful combination. We basically tell patients it's like the atom bomb for intestinal parasites. Wipes them out, wipes out candida and other types of fungus and yeast. It's extremely effective. Okay. Other things, cloves. Cloves works very well. Another one is wormwood. Before anybody complains, I know that there's a lot of rumors out there about wormwood. If used correctly and safely, wormwood is extremely effective for working with parasites. Again, I'm just giving you what has historically been used, not recommending that you use these themselves, but with a proper healthcare provider, it's extremely safe to use. All right, other things like apple cider vinegar. Brags. We only prefer Brags, not the pretty golden stuff that's in the store, but that most people see for cooking. But Brags apple cider vinegar with the mother in it. You shake it and you see all the little stuff, little filaments and stuff. Very, very effective against parasites as well, and also helps raise your alkalinity up as well. Lemons, limes, they're very good for it. Let's see, oregano oil, turmeric, those are all good things. Garlic, absolutely superb. Okay, yes, you're going to smell if you eat it, but garlic is extremely effective for parasites. Now keep in mind, garlic while it is a massively effective anti-parasitic, antibacterial, antifungal, cooked garlic is worthless. It's great culinary. It's great in your food, but cook it, you've destroyed it. There are approximately 35 sulfur compounds in garlic. That's why garlic's old nickname is Russian penicillin. During the World Wars, when Russia would constantly run out of anti-infectives, they would return back to their old standard, which was garlic. Garlic, it is a medical fact that 3 to 5 cloves of fresh garlic is the equivalent in efficacy and efficiency to an adult dose of penicillin. 3 to 5 cloves of garlic is equivalent to an adult dose of penicillin. It only attacks the bacteria that's out of balance, not the beneficial, so to speak, bacteria. All right, so you can have it fresh, you can have it raw, you can have it dried in capsules. You can make garlic oil out of it. We recommend something in the clinic we call a flu stew, where it's a potato stew. You cook the potato stew up, not the garlic, but the potato stew. And then when the potato stew is done, you take a bowl out, take 3 cloves of garlic, crush them with a little garlic press, put that in the stew, and eat it. That way the garlic doesn't get cooked, and the potato stew is wonderful at dulling down the taste of the garlic somewhat, as well as the odor. People will complain and say, well, I can't have that odor. Okay, well, you know what? I'd rather have the smell than the parasites by a long shot, or the infections or anything else that they're dealing with. Dr. Christopher used to make a joke about how the reason garlic was so effective is because it made you smell so bad that sick people stayed away from you. Cute, but it is still quite effective as an antibacterial, antifungal, antiparasitic. So that would be one of my best things that I personally do. And one of the things that we do during a parasite program at our center is, besides nutrition, besides the antiparasitic formulas, we have a syrup that we use that works very, very well. We also make sure that we keep the bowels moving. Okay, again, if one of the issues with parasites is constipation, then you want to make sure that you keep the bowels moving, because we want this dead parasite and the eggs flushed out of the intestinal tract. So there's a lot of natural bowel movers that you can do. We use some at our clinic that works very, very well. But keep the bowels moving, stay very well hydrated, keep the nutrition up. Again, historically, walnut, garlic, wormwood, all these historical, clove, apple cider vinegar, they all work. They all work wonderful. Now, a little key piece of advice here. When you're going through a parasite cleanse, it can be uncomfortable. Just like with candida, getting rid of candida, you can also get a Herx response, a die-off from when the parasites die. They secrete a toxin, make you very sick feeling. Okay, as long as you know that that's coming, as long as you know to be aware of it, you can get through it. Thing is again, lots of fresh fruits and vegetables to flush this out, lots and lots of fluids. What are some of the things that you might feel from a parasite die-off? Abdominal pain, be a lot of bloating and gassing. Yeah, that was a symptom before. Well, it can be a symptom during the cleanse because there's so much die-off. That's why it is important during a parasite program to keep the bowels moving, get this going. Bad breath. When things are dying on the inside and your body's trying to detox, some of it's going to come out your breath. It can be actually a good sign that it's working. All right. Bruising, because the body's still trying to recover. Digestive problems, emotional issues. We've seen patients get very anxious or very depressed, especially anxious during cleanses, because their body is just doing its best to detox and they get very anxious. It's just a part of the cleanse that we've seen before. Lots and lots of water. Some people even get facial pain. Okay, I've actually seen that type of thing before. Again, it's all part of the cleanse. Fatigue, headaches very, very common. Headaches can occur, joint pains, muscle pains. These are all, even skin sores, weakness, pain around the eyes. All those things are relatively common, but the most common, gassing, bloating, upset stomach, abdominal pain, more diarrhea, because it's trying to, now the body's actually trying to successfully get it out. And fatigue, headaches, those are all things that are very, very common. It is not a bad idea, especially for those patients or people who are going through a serious parasite program, to consider going to a hydrotherapist and getting a colonic done. And for those of you who don't know what a colonic is, most people know what an enema is. Well, a colonic is a super enema, and you get it done by a licensed hydrotherapist. It's a fast way to get a lot of this dead stuff out of there during the die-off of the parasites. And you still need to do the program, usually for about 3 weeks, but the amount of die-off symptoms will be greatly diminished by doing a colonic. Highly recommend them for issues such as this. All right, well, I think that's pretty much it on parasites. It's actually not a complicated thing to take care of. Again, to refresh here, most people are not tested. A minimum, given by the CDC, 1 out of 6 people have intestinal parasites. Most don't know they have it. It is very simple to test for. Most don't test for it. It needs to be tested for it. If you suspect, go get it tested. Very simple to treat once you have it. You can opt for Western medicine if you want to. We find that naturopathic, natural medicine is every bit as effective, and you don't have liver damage and other issues like that. All right, so that pretty much does it for parasites. This is Tree of Life Holistic Wellness Center. You can find us at treeoflifehwc.com. In case you want to, you can check out the site. There's a lot of free information on there. If we can help you, we'd be more than happy to. Please look forward to future episodes with us. We're going to be talking about nutrition. We're going to be in the future episodes, nutrition, and one of the next episodes coming up very soon is going to be about home first aid. Things that you can do in the home, how to build your own first aid kit for a wide variety of issues, and things that you can do yourself and can have in the house. And again, we'll be talking about nutrition, and we'll cover a lot of other issues. So I look forward to talking to you all here again in the future. And everyone have a most blessed day. Bye-bye.
Let me bring you songs from the woods to make you feel much better than you could know.